Right. So we have today Sara Szczotka, who's at Home and New Vision, is also the co-chair of this group, and Brianna Dobbs, who oversees the ROOT program. They're here with us today to talk about a recent grant that they got to expand the ROOT program. I know we've talked about the ROOT program in this group before, so it's nice to see that we're able to build on some of our successes with that. So with that, I will turn it over to them. Let me get the presentation up here real quick. There we go.
Thanks, Matt, and thanks for letting us join today and the invitation, and welcome to everybody that joined our group today. So like he said, my name is Sara Szczotka. We are here to present on the Recovery Opiate Overdose Team. That is a program of Home and New Vision. We are supported by our Huron Valley Ambulance, the Washtenaw County Community Mental Health, School of Nursing, CMH, PSM, MDHHS, the Sheriff's Office, and we're really here to talk with you all in hopes to gain support from all of you guys and your great organizations and the Washtenaw County or Washtenaw community in general as well. So back in 2017, in response to the opioid epidemic, Home and New Vision and Community Mental Health partnered in opening up the Recovery Opiate Overdose Team, or ROOT team, as we'll be calling it from now on, in order to respond to people who had had an overdose event and had been transported to the emergency department. We realized that this was a really good time to engage people because they had like a moment of clarity. They tended to be more open to services. And the team included a case manager and a recovery coach, both going. It was a 24-hour program, 24/7. We would respond at any time, day or night. And we would provide connection to treatment services if that's what the person wanted. We could connect them to medical services, and we provided a great deal of social support and connection to the recovery community. The program was completely voluntary. People could choose to engage in it, and we found that a lot of people were willing to at that moment. So the ROOT process works when it starts to be engaged and the coaches and case managers get called out. When an overdose happens, a community member or whoever will call 911, and police mass is dispatched, and they go to the scene. Once naloxone is administered, the patient then gets transported to the emergency department via ambulance. And then the first responder, whether the police department or EMS, will call CMH's access line. The access line will call whatever recovery coach or community or case manager is on call, and they will go to either of the emergency departments in Washtenaw County. The recovery coach will then go day or night and engage that person in whatever kind of services that person decides that they're ready for. And we'll follow up with them for 90 days, whether that is, they go to treatment and, we get them there, follow them through that path, or follow them afterwards. If they decide that they're not ready for treatment, what are some steps that we can get you connected with to maybe better prepare you for in the future? Do you have an insurance card? Are you connected to a primary care physician? Do you want to try out any recovery meetings in the meantime for some social support? Like, it's really about client-centered services and whatever that person wants. So from program implementation in October 2017 to March 2019, ROOT responded to 123 overdoses, and 72% of the time people wanted to engage. Like I said, it's that moment of crisis. It's that moment where people decide that they might be ready for a change, and just having a conversation really moves people, towards a direction of recovery. We did a really great job of engaging people that did end up going to the emergency department, but there were a few areas in the population that we weren't able to meet, and those were people that declined any sort of treatment, whether that was getting on the ambulance, wouldn't go at all. They left the emergency department against medical advice, or sometimes people would get on the ambulance, get all the way to the hospital doors and leave. So we didn't get a chance to engage with those people. In Washtenaw County, we did a really, really phenomenal job with pushing naloxone to friends, family members, and allies. So sometimes those survivors would not get connected to any formal services. They would get revived by their family members and just go about their regular life. Sometimes first responders are extremely busy, and maybe it slipped their mind, but the overdose didn't get reported at all to the CMH access line, so those people were lost as well. And then occasionally, by the time we would get to the hospital, we do get there within an hour. And like I said, people would leave before that hour. And the phone number that they gave to the police was incorrect. The address they gave was incorrect. So there was no way to reach those people again. So we did a really good job of getting to the hospital and engaging those folks, but there were some areas that we felt that we could do better. I don't know if you guys remember, but last year we had a presentation from the folks that had started up for the QRT team. If you weren't here for that presentation, it was started in Ohio and Virginia, and it was a pilot program to respond to people at their homes when they had an overdose. The team was made up of recovery coaches, law enforcement, nurses, EMTs, and faith leaders. And, it's really to target those people that didn't go like the traditional route to treatment services or the emergency department. But in addition to that, it also pulls together the community. It lets people know that we care about them, you're worth recovery, your life means something. And all of these different people, no matter from what walk of life, whether you're in the treatment or substance use field, you're in law enforcement, you're in the medical field, or you're just, a faith leader or a community member, we care about you. And we're all going to surround you and during this tough time and get you whatever kind of support that you want. So the team partnered with them, and they were given the person's name, their address, and some basic information so they could report to their home. These pilots showed really great success because of that. Michigan Department of Health and Human Services put out an RFP within Michigan to kind of bolster what we have already going on in Michigan, or for some areas that don't have these great programs already. So Home of New Vision was awarded this expansion program to the service that we already have. So we submitted the RFP and this expansion. We're now working with Huron Valley Ambulance, the Sheriff's Office, School of Nursing, and the CMH. We're going to be working more with community members. We're pulling in some of the faith leaders in Ypsilanti. We have some volunteers that want to get engaged and give back. So we're going to be partnering or having the original group program where we respond to the emergency departments and providing this wraparound service to catch any people and any of the gaps that they were slipping through before. So this will be called Root Plus. Root Plus will be fully implemented by January 2021. Like I said, we are just building upon services that we already had. Previously for Root, we will still be doing the emergency department, and we will be doing the wraparound services in the community. That means that, you know, if someone's grandma or aunt, you know, they revived someone, if the person wants services, that we can come out to their own home. We have family recovery coaches to provide support for, you know, grandma, and we have recovery coaches and case managers and the community that will support the overdose survivor as well. So this program expansion is designed to prevent future overdoses and reduce harm from substance use, engage survivors in ways that we were unable to in the past, like we've been discussing. I think one of the major things is that we're really wanting to integrate, you know, the family into receiving care as well, and support for them. We feel like that's a really big value. Substance use disorder impacts the whole family, so the whole family should be able to get support like the person who's had an overdose does. So linking the family to resources and support is really something that we think is valuable. And we're going to promote a person-centered and community-supported approach to recovery. So really pushing family and friend support, and then also supporting the person with the entire community.
So with supporting the community, we have been doing community education events. So far, we have done mainly naloxone events. We were able to partner with the Community Family Life Center in Ypsilanti to do a drive-through naloxone event where we were able to train 24 individuals in October. In partnership with the Washtenaw Recovery Advocacy Project, we've also partnered with the RIDE to distribute at the transit centers. At the Blake Transit Center, we were able to get out 109 kits into the community. And at the Ypsilanti Transit Center, we were able to get out 144 kits into the community. We got a lot of positive feedback from the community members. There were people there that, you know, were really grateful to see us out there and said that they could have used a kit either 2 weeks ago, or there's one gentleman that said he could have used it the week before because his neighbor's daughter overdosed in their basement. And there were several stories like that. And then we will also be holding a virtual naloxone training this Thursday at 6:30 via Zoom. And then we'll be delivering the naloxone kits the next day in Washtenaw County, and we can, we're going to mail them out if someone's not in Washtenaw, since it's online, and there can be other counties and stuff that would participate. And then, so our program expansion status so far, like Sara had touched on, we will be fully operational in January. We're finalizing the data sharing process with Huron Valley Ambulance. We're looking to expand our local referral partnerships. And then we've expanded our team already with an additional case manager and peer recovery coach. And then we're also looking to recruit more family support professionals and community members. We have a team already, but we're looking to grow that team to include more members of the community. And then we're also refreshing law enforcement on the overdose reporting to access, so we can continue to get those referrals. And Root met with the chiefs of Washtenaw County to present that last month. So if you're interested in being part of Root's Community Referral Network, you can email me at bdobbs@homeanewvision.org, or if you know anybody that you think would be a great addition to our team, any family support professionals or a community leader, you can reach out to me as well.
I just really want to stress that part of the engagement and going out to people's houses, it's not just professionals, and it's not just aftercare support that we're asking community members to be a part of, like whether it's a family member or a volunteer or an ally or a friend, if they want to go provide support at a person's house, they will be able to join us, at that moment of crisis, and providing support to the person and their family as well. And we really want to bolster our community referral network. So please reach out to us if you have a specific person, like Ashley at Unified. If you have a specific person that you think would be really valuable, please let us know. So if anybody wants any harm reduction practices and services, that we can refer them to that person and know that they're going to be taken care of. We really think that's valuable. So we think that would be great if you could reach out to Brianna.
Are there any questions?
It's Ashley. I have a question. Thank you, Sarah, for mentioning the harm reduction piece. So with these models, the concerns are for the success rate for individuals with more polysubstance use and various backgrounds with the criminal justice system. So will these programs provide harm reduction education to individuals, such as safer use and discussion of adulterants that are concerning right now? And then to follow on that, will the police be attending these post-drug poisoning events, like going to their house?
Thank you for those questions, Ashley. So I think that that's why we want to do the referrals. I know that, I think it's extremely valuable for our recovery coaches to know about harm reduction. They attend trainings on that, but I know that you guys are the experts in that field, and we want community collaboration. So if it's something on a basic level that we feel like our coaches are well trained in, we can provide that education. But if it's a specific service and education that you would be better suited for, we would definitely want to make that referral to you. And then as for your second question, at this time, law enforcement will not be going to the door. That was something that we have discussed, but it doesn't seem like that is an option at this time. Did that answer your questions?
It did. I just know that's kind of been, what we've been hearing from the community of those who will not go to the ER or who will not seek out other services was just, the lack of some of the recovery coaches and more focus on abstinence only and not providing harm reduction supplies in the ER was some of the biggest pieces we've heard, is that, if they're going to go back and they're not getting a buprenorphine induction in the ER, or if they're not being referred to one of the providers of methadone, then that would be, reasons for them not to seek out those services, because they weren't offered, every type of gold standard intervention.
I can't speak to why that might not have been happening before. I know that it's a thing that we've stressed as far as training, especially with this program specifically, because it is opioid specific. So I'm not really sure, and I don't have an answer for you on that, but they've done harm reduction classes, training, they've gone over practices, and, if it's something that, they've gotten training on how to, refer to like other MAT programs. So I'm not really sure what you're specifically referring to, but they've gotten training on all of that. And that is something that we believe in and I personally believe in. So I make sure that that information is passed on to our recovery coaches, and that's something that they pass along to our clients.
This is Marcy. I just want to say that the so the intent of both the ROOT program and the wraparound is to really sort of support whatever go in to the connection with the client with a completely open mind. And we know that the clients may or may not choose to go into treatment, and that's certainly okay. We want to be able to be there for them. So so all those alternatives are available, and as Sara said, they're discussed with the client. So I think if there's a way to sort of let the community know, meaning those folks that are out there on the streets and who might end up having an overdose or a high-risk situation, and their families, that information is passed on. So there are multiple pathways to recovery, and one of them may be a harm reduction model. The one thing that I was wondering, Ashley, is in terms of things like needle exchange and some of those other alternatives, being able to have that information to the recovery coaches as well might be helpful, because if we're still doing needle exchange in the community, that may be another tool that we have to reach out to these folks. So are we still doing needle exchange out there?
Yes, we have a syringe access program, and it's been expanding, and the need has been very high. We probably get around 100 up to 300 one of the months this year for reported reversals, and the majority of our participants are not going to call 911.
Yeah,
I can say that during our one of our naloxone events, I was able to tell more than one individual about the services that Unified has. So we are aware, and we are letting them know that those services are out there.
And I'm wondering if there's a way to really, we don't have to do it here, but I mean, a way to figure out how can we help those individuals that are out there that are being served by Unified, and then perhaps be able to link them with some of the ROOT services, like the community education pieces and things like that, or even partnering on some of the recovery services, the coaching services, or that can be done through WRAP. But it seems like those two programs are so integral, and they sort of align very nicely. I'm wondering if more could be done to bring them, bring that partnership together.
Yeah, I mean, we could discuss it further. I know Lamont's worked on it, and he's here too in the background, but we've worked on this he's done it for 20 years that we've been around. And, we really listen to our participants, and it's just, I think there's a big disconnect sometimes, and people think of harm reduction not incorporating abstinence, right, as some individuals' goals. And we've just seen like not as many referrals to, say, methadone and some other gold standards, right? That really right now with, we'll just say fentanyl, I'm not even gonna call it heroin, but it's not gonna work, like Vivitrol, Bupe, it rarely works. And I don't, sometimes people are using because of their family, right? And I think we have to take that into account of the person's situations and really just listen to what their core needs are at the time. And some, are at that moment where they do want to hear about recovery, but other times they don't, and they're worried about food on the table or housing. And I don't think we should just center it around opioids, because 9 times out of 10, it's polysubstance use. There's other chemicals. It's not been opioids for 15 years.
Yeah, unfortunately, these are all federal grants. So and when you think about it, it's like, yeah, all this effort is going in into opioids, but yeah, there are some restrictions that the grants require folks to have, especially all the opioid grants that are out there. But as long as there's an opioid around, anything else is okay. The services, but the services should be really focused on someone with an opioid use disorder. But yeah, they could have other substances that they're using, but as long as there's an opioid use disorder, then the grants are able to serve them.
Do we have any other questions?
Anybody else?